Forks County Commission meeting. For the report, I believe is Commissioner Falk here?
I am.
Okay, wonderful, Commissioner Falk. Then Commissioner Falk and Commissioner Engen are on by telephone, and Commissioner Ross, Commissioner Knopf, and myself are in the chambers. So we will begin the commission meeting. The first item on the agenda is the approval of the minutes.
So moved.
Okay, it has been moved. Is there a second to the minutes?
I'll second.
All right, it has been moved and seconded. Anything to bring forward from the minutes? If not, assuming a roll call vote, all those in favor of the minutes signify by saying aye.
Aye. Aye.
Aye.
Opposed, same sign. The minutes are carried. The next item is the approval of the order of the agenda. Do we have a motion to approve the order of the agenda?
I'll make a motion to approve the order of the agenda.
Okay, is there a second to that motion?
Second, Tom.
Okay, if there is no discussion, assuming a roll call vote, all those in favor of approving the order of the agenda signify by saying aye.
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 Opposed, same sign. Then that is approved. The next item is the approval of the consent agenda. There are bills, some employee status changes, overtime. If anything wants to be brought forward, please say so now. If not, could I have a motion on that?
Motion to approve, Tom.
Okay, there is a motion. Is there a second to the motion?
I'll second.
Second, Dave.
Okay, then approving a roll call vote. All those in favor of the motion signify by saying aye.
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 Oh, sorry. Opposed, same sign. The motion is carried. The next item on the agenda is public health. Debbie, do we have you with us today?
Yes, good afternoon, commissioners and Madam Chair. I do have a brief presentation, but first I would like to introduce Michael Dulitz, who will be able to give you a data update as usual on the status of Grand Forks County, and then I'll follow that up with some information on vaccinations and also a formal request. So I will let Michael take it away. I believe he might be sharing his screen and presentation.
Okay, Mr. Dulitz, are you with us today?
Can you hear me okay?
Yes, we can.
Madam Chair and members of the Commission, my name is Michael Dulitz. I'm the Opioid Response Project Coordinator at Grand Forks Public Health and pinch hitting in a COVID-19 data role as well. I'm going to give you a quick overview on where we're at and where we're looking with our health officers dashboard. So overall, there's a lot of good things that are happening with COVID trends in the community. Overall, we are seeing a decrease in the number of COVID cases in the community. We're still seeing, relatively stable amount of testing. Our percent positivity is decreasing, as well as our hospital capacity. There has been some change in that over the past, the past 3 or 4 days since the start of the new year, where we have been seeing a little bit of a change. So more specifically looking at our COVID cases, we have seen a slight uptick in our COVID cases. What is likely happening is with the holiday, there's been decreases in testing with, drive-through testing availability, maybe a little bit diminished, fewer people wanting to go get tested, things of that nature. It's likely that we're kind of catching up from some of that. That would be my best estimation. But we have also seen, some impacts already, related to, Christmas holiday gatherings causing some, isolated clusters and things of that nature. So you can see on the graph that there is a small increase that you can see there. I just wanted to look a little bit closer, looking at, a scale that we would have looked at in August or something like that with our COVID cases. Since we had such a big outbreak in November, it can kind of make, small changes look, what used to be big changes look rather small. So we have seen a bounce up. We were at our lowest point at about 16.7 cases per 100,000. So that would be about an average of about 14 cases per day. And we are up at about 17-ish cases per day in Grand Forks County. There was a period of time where we even had, some young age groups having, less than 5 cases in that age group over the course of an entire week. Looking at ages, as I had mentioned, younger age groups, they saw kind of the major or the largest decrease in the case counts in the community, and have since started to increase slightly. Followed by the young adults, so the individuals in the 20 to 29 age group, again have started seeing small increases. The 30 to 59 age group, the increases haven't been that as pronounced over the past few days, but there has been a slight increase. They were kind of driving a lot of the case, a lot of the caseload over the holidays. Whereas the 20 to 29 group and the 0 to 19 age group, we're seeing relatively strong decreases. And then the 60 plus age group, which has relatively leveled out. Looking at our incidence curve. So the incidence curve gives us a good idea of what our growth is looking like. The more linear it is, and the more horizontal the line is versus vertical line, more vertical would be more exponential growth. We're leaning a lot more towards horizontal line. So the slope is decreased an immense amount over the past month or so. So as you can kind of see from the green dots, it gives you a little bit of an idea what our slope looks like. So over the course of 35 days, we had added 4,000 additional cases onto the total case count for the community since the start of the epidemic or the pandemic, versus a lot smaller increases previously. So we had that exponential growth, and that has slowed, and we are moving on more of a linear path right now. So to give you an idea of what that looks like, we can look at some projections. Previous times when I talked to the commission, I had presented some pretty sobering statistics of what our path could look like if we kind of stayed the course that we were on with case growth in the community. On 11/1, this is the projection that I had provided of the number of cases that we could look at over the next, couple of months. 11/30, that started to come down. 12/7 has decreased even more. 12/14 even more. And your ideal projection, the ideal projection, as I'm talking about that's less than 17 cases per day, which would get us below 25 cases per 100,000. So we're just right below that ideal projection right now, which is good for us as a community. Looking a little bit more detailed. Again, this is the projection I provided on 10/21. The projection I provided on 10/28, 11/1. So these were all, the slope was all increasing. And now you can see the slope slowly decreasing. So I am happy to say that I was over 100% wrong in my predictions. What we did see, or what I had predicted based off of the previous COVID cases has not been the case, and we have seen our projections decreasing. One thing that I had talked about previously was the doubling time. The doubling time is just a figure based off of what we've seen with case activity in the 14 days before. It gives us a projection on how long it would take for us to double the number of cases that we would have. So that number is now just short of 500 days, which is the highest that we've ever seen it. It needs to be a lot higher because we have a lot higher incidence. So we've counted more cases in the community. So it's going to take a lot longer for that time to double. So for us right now, we're at right around 9,000. It would take a lot longer for us to double to 18,000 if we, if we kind of followed the trajectory that we were seeing previously when that number was much higher. So we need this number to be high like this for us to kind of stay on that 25 case per 100,000 trajectory. So we are still following that relatively well. Looking at the deaths reported in the community, we have had 67 deaths through today reported in Grand Forks County since the start of the pandemic. So those 67 deaths, those are counted by the death date. So, when you see that number go up, but it doesn't look like the curve is going up, that's because it does take some time for those to show up on our death counts. Fortunately, our death curve is kind of flattening out, just like our incidence curve. So a lot of what we're seeing from that major outbreak in November, we're starting to see that any deaths that may have occurred are probably pretty close to being completely reported. And then getting closer to wrapping up here, looking at tests, I had mentioned that I thought we were still doing a good job with testing. So this is just looking purely at PCR testing. So the testing like you would get at the Altru drive-through, or most tests through like UND, where they where it takes you like 24 hours to get the results back. This is that type of testing. We're still keeping a relatively high number and the highest among our peer counties and our peer areas, which should provide some comfort on, that we aren't missing cases. And then finally, looking at hospitalizations, our hospitalization numbers have decreased pretty significantly in the Grand Forks area. Our hospitalization number for, as reported out by Altru, is hovering right around 10 people with COVID hospitalized at Altru. So we're also, lower than most of our peer counties as well. Looking more regionally, North Dakota is now the lowest in active hospitalizations. So comparing to Minnesota, South Dakota, and Manitoba, North Dakota has had a significant decrease, and part of that is improved data reporting. And then looking at case comparisons, North Dakota is still higher than Minnesota and Manitoba. And then looking at our bottom lines, so our strengths right now, the 0 to 19 and 20 to 29 age groups, those we saw significant decreases in the number of cases in those age groups, which does put us in a lot better position for looking at the start, the resumption of school and the resumption of school, university, athletics, things of that nature, puts us in a good spot for that. That doesn't necessarily mean that we're in the clear for it. So, we're seeing these numbers low. That's a good sign for us. It's a lot better than if they were high and we were looking at the same situation. The hospitalizations and deaths seem to have, plateaued at a lower level right now, which, is also putting us in a better situation as a county. We have been adding additional testing capacity, trying to target different groups in different manners, using Binax testing from the provided to us from the state. So the state has been very, very, very encouraging of us to use the Binax Now testing, and so we have figured out a good mechanism to make that happen with some collaboration from the fire department and Grand Forks Police Departments. We've offered some testing through some of the malls in Grand Forks. And then Ultra has also been able to in-house some of their lab testing capacity. And so the drive-through testing that's happening, a lot of those drive-through tests are being run actually at Ultra now versus being sent out to the state. That decreases the amount of time it takes from testing to results, which decreases the amount of time that people might be going out doing activities while they wait for those results. Again, lots of positive things. We did move into orange briefly yesterday on our health officer dashboard. We're back down into yellow. That was just probably, maybe a little bit of an aberrancy. We'll see in the coming days. But we have seen an increase from the base at that 16.7 cases per 100,000. Vaccination is ramping up. I'll let Debbie, kind of talk about that. But we are seeing some clusters related to the Christmas holiday. I have some additional slides, which I I can make available for the minutes. Otherwise, you can look at the slides on the city council agenda from last night as well, and I'll make sure to get them sent to Debbie. With that, are there any questions?
Anyone have any questions of Mr. Dulitz? Certainly good news to see numbers going down and dropping, and let's hope that in the next few weeks we tend to see that same trend continue on. Debbie, you have some information to share with us?
Yes, Madam Chair and members of the commission, I'm going to attempt to share my screen and my PowerPoint presentation. Are you able to see that now and hear me okay?
Yes.
All right. So I'm going to provide a really brief high-level overview of where we're at with vaccinations, because there are still many things that are unknown at this point in time, but it's certainly good news that we have more than 400 enrolled providers in North Dakota, or close to 400. So that's really good news. We've really penetrated the state with lots of opportunities for people to get vaccinated when vaccine is available in their communities. The long-term care facilities have some options for pharmacy partnerships to vaccinate residents and workers. And this was a national program that was rolled out across the US. I heard today that all states except for 2 have enrolled in this pharmacy partnership. And indeed, some in Grand Forks County have done so with either Thrifty, White, or CVS. And those partnerships, along with any long-term cares that are doing their own vaccinations, are doing both residents and workers. And I've been hearing really good reports, especially about residents wanting to be vaccinated. Workers is taking a little bit more time to show some solid uptake, but I think it will certainly come now that the holidays are past and many people have been vaccinated without any problems. The North Dakota Department of Health is allocating vaccines weekly, and providers have 24 hours to accept or decline. So we typically will get notification like on a Friday of how many doses we'll get for the next week. And if we are still in a situation of needing to vaccinate the particular group that is the focus, we will accept that order. We will accept any and all orders, to be honest, because we have a lot of capacity to deliver vaccines, and then we will plan a clinic for the following week with the tiers as indicated. We are also getting some supplies needed to administer the vaccine provided by the federal government. And from everything I've heard, they are good supplies. They're exactly what we need. We have had to augment them a little bit with some of our own resources, but we've had the funding to do that with our CARES grant. These are the vaccine planning partners in Grand Forks County, and you can see we have a really nice mix of public and provider, large institutions like Altru and the Grand Forks Air Force Base and UND, and then we have some smaller entities that may vaccinate a smaller number of people, but they definitely all play a really important part. There are actually 23 enrolled sites for vaccination administration in Grand Forks County. Pharmacies are listed there. We kind of group some of the sites together And you can see it, we do also have Larimore and Northwood locations that are also vaccinating. This is a little bit of information about the prioritization, and it is complex, and it is probably what we get the most questions about and people want to know the most information about. But we're currently in phase 1A and then tier 1A within that first phase. So there's a couple phases, but within each phase there's many tiers. And right now we are on healthcare workers and long-term care residents. So you may have seen in the news that Altru has been vaccinating their healthcare workers. Grand Forks Public Health vaccinated our frontline workers that will be responsible for our vaccination clinics and others who have exposure. And then long-term care residents have been getting vaccinated, and that's also been in the news too. So it's been really nice to see that. I have a theory about the uptake among long-term care residents, and I think it's because many of them have lived through experiences of vaccinations coming out after there have been some really challenging situations with childhood vaccine preventable diseases. And so the uptake is really positive among that cohort. And among healthcare workers are first responders. So we have invited first responders from all of Grand Forks County to attend clinics, one that was held last week, and we'll be having another one tomorrow and another one on Saturday. And for additional information about the tiers that are within phase 1A, you can click on that link within there, or you can just go to the health department's webpage and click on the COVID buttons and then the vaccine buttons, and it will get you to all the information on all the priority groups. But there are a lot of other tiers within this phase 1A, tier 1A, the next tiers beyond 1A that include small business or small practices of healthcare workers. So like behavioral health providers and dental offices and oral surgeons and many other groups like that. And then we would move on to phase 1B, which you probably heard about when the governor announced this last week. North Dakota is prioritizing their phase 1B to be older individuals, people with underlying health conditions, other types of congregate settings where transmission can be a problem, and then childcare workers, employees of preschools and kindergarten through 12th grade. There is some additional information that gives you more details on all of these specific groups within phase 1B. But just to give you a little bit more information for today, when we talk about older individuals, we would start with those 75 and older, but then move on to persons aged 65 to 74 with 2 or more high-risk medical conditions, and then staff and residents living in other kinds of congregate settings like group homes, treatment centers, jails, homeless shelters. And then we would move on to persons 65 and older with 1 or more high-risk conditions, and persons 65 and older with or without high-risk medical conditions, and then on to the childcare workers and employees. So I'm sure you have figured out by now that this is a really, really large group of individuals. So we may have to start with those tiers and invite each individual group as we receive vaccine. We don't want to wait till we have all the vaccine for the entire phase. So this is the part that's going to really require a lot of patience by the public and a lot of communication by us as healthcare providers and public health professionals, so that we can invite people at the time we have vaccine for when it's recommended. And then moving on to phase 1C, this is the large group of essential workers. You may have heard that the federal government, the CDC specifically, is recommending that essential workers be placed ahead of the other groups that North Dakota has identified in their phase 1B. But more and more states are moving in the other direction, as North Dakota is, primarily because they see the tremendous disease burden among some of those groups. But in some areas, essential workers have really been placed at risk and also represent a more diverse population. And so in some areas where there's been high disease burden among other groups of individuals, especially people of diverse ethnicities, they're moving forward with essential workers first. So a little bit about what we have received at Grand Forks Public Health. We've received the Pfizer BioNTech vaccine and also the Moderna. These are the two that have been received emergency use authorization by the FDA. The Pfizer vaccine can be used on persons 16 and older. It requires the ultra cold storage, and it can be refrigerated for 5 days. Because our state is sending out increments that are fairly small with vaccines, they are redistributing their large shipments that come into the state. So once they reallocate it, they cannot reallocate it frozen because it won't maintain that frozen temperature. So the refrigeration of 5 days starts from the moment it leaves the state warehouse. Fortunately, it gets to us within about a half a day, but that means we have about 4.5 days to make sure it's administered. It's 2 doses and they're 21 days apart. This is the first vaccine that Altru received, and they are already starting now their second dose because it's been 21 days. We did receive 200 doses this week, and we'll be doing our first responders tomorrow with this vaccine. And then the Moderna vaccine also arrives frozen, but it allows for a longer refrigeration period. It can be refrigerated for up to 30 days. We don't anticipate ever having vaccine in our refrigerator for that long. Hopefully nobody does. We want to get it administered. It's 2 doses, 28 days apart, and this one can be administered to anyone 18 years of age and older. There is not currently a vaccine for children, but there are some clinical trials that will begin so that hopefully there will be a vaccine for children eventually. We received 150 doses for healthcare workers, and we administered all of that, completing that on December 30th. And we will receive another 100 doses that we will administer on Saturday. So you can see there's a big balancing act here with multiple vaccines, different requirements for their storage and handling, different dosages, different preparation, different ages. There's really a lot to remember. So we're proceeding very cautiously, very carefully to ensure that we have no wasted doses at all. The good news is so far, with both vaccines, we're discovering that there are often what we call angel doses, where we can get an extra dose out of a vial. It can be administered. It can't be combined between 2 vials, but it has helped us to expand the number of vaccinations that we can provide at any clinic. And then just some general recommendations that I want to put forward, because they're really good talking points if you should happen to be asked about it. We highly recommend that everyone accept vaccination when it's offered to you, to not decline it, because we just don't know what the supply is going to be, and it might not be available for a future offering because we may have moved on further, or it may simply not be available. So when vaccine is offered, we highly recommend that people take advantage of that opportunity. Because of the large number of people we have in our county, instead of having lengthy lists that people can sign up for and managing all of that, we're recommending that the public watch media and communication from providers about vaccine availability. It's a little bit challenging right here in the beginning when we have so few doses, but once we have more doses and regular clinics, we expect that we'll have some regular communication with the public about when they can come in to be vaccinated. Grand Forks Public Health anticipates doing all of our vaccinations largely at the Alaris Center to start. We'll supplement any efforts in the county where there's a large number of residents that need to be vaccinated, and if there's not a provider there to do that. But initially, we would expect some travel is going to be required. But ultimately, there will be vaccine that can be delivered, possibly through home care entities for people in their homes, through small clinics and at the front line and primary care. There are some mild side effects that can occur, but that's just the body's immune response, protecting you from the disease. I got my vaccination on the 23rd of December. It was my Christmas gift because I can be a vaccinator. And I had a little bit of a sore arm, and it was really nothing more than a tetanus shot. In fact, the shingles shot hurts more than a COVID shot in terms of discomfort later on. And extra precautions are taken at all of our clinics to respond to the very rare reported allergic reactions that have happened across the US. We've had 2 in North Dakota that required treatment but not hospitalization. They happened someplace in Bismarck. And so we will be asking people to stay for 15 minutes after they get their vaccination to ensure that nobody has had an anaphylactic reaction, which we can treat on site. For people who have had an allergic reaction to foods or other substances, we're still recommending that they get the vaccine, but we will ask them to wait for 30 minutes instead. And we have arranged for EMS support at our large clinics as well. We're also positioned really close to ambulance and fire response with our central location. Don't expect any problems in that regard, though. General guidance also includes that the vaccine is highly effective at preventing disease and especially severe COVID-19 disease. So in the placebo group, there were a number of people that developed severe disease, but in the control group of people who received the vaccine, both with Pfizer and Moderna, in some cases there were 0 cases of disease, or excuse me, there were 0 cases of severe disease, even if there were some cases of mild disease. So that's what we really are aiming for here. But more information is needed to measure how well it actually prevents the transmission of disease. We know it prevents people from getting COVID, but how well does it prevent us from spreading it asymptomatically to others? And we'll be constantly monitoring that. Therefore, wearing masks, watching your distance, washing your hands, and all those other public health mitigation measures are going to remain important until herd immunity is achieved through vaccination. And vaccination is absolutely the best way to achieve that herd immunity rather than natural infection, because natural infection can lead to, we know, some serious disease and some long-term consequences, but also can really place a heavy burden on the healthcare system. So it's not something we want to see happen. That's been our goal all along, and it remains our goal. So unfortunately, we won't see our masks go away anytime soon because it will take us a number of months to get through the population. I've provided a couple of pages of resources here that feel free to browse through those when you have time. I can send you the actual PowerPoint presentation if you prefer that, so you can actually, those links are functional to you. I'm not sure if they're functional in the PDF document, that in the manner that it was saved. But I'd like to point out that very first one there, which is the health vaccination dashboard. It demonstrates there how many doses of vaccine have been given across the state and then also by county. And those are updated typically on Tuesdays. So today it shows that there were 2,400 roughly doses administered in Grand Forks County, but I suspect it's much higher than that because it may not have had all of the doses updated like from yesterday. Our providers are continually offering it. At Grand Forks Public Health, we will use a registration software called PrepMod, which allows us to have people register before they come in. We'll know exactly how many people are coming. It will allow us to notify people as soon as they've had their vaccine. It will get entered in and they can get a confirmation text message or email message. So there's a lot of really nice features to that. And then there is another page of resources. And I have one more slide on a slightly different topic, but I can entertain any questions on vaccine first if there are any from the commission members. And thank you for the opportunity to provide this overview. Any questions?
Debbie, I have a question. Right now, it seems like, and I don't know this for a fact, but it seems like the amount of dosages that we're getting, vaccine dosages, is small. Do you anticipate that to increase higher in the future?
I am not able to hear the question. Could you speak up just a little bit?
Okay, my question is that it seems like the amount of vaccinations or that we are able or have gotten to date, which it's just new to us yet, but you were talking about 100, 150 dosages, that sort of thing, just that you folks have gotten. And so do you anticipate that the number of dosages that you will get going forward in the future will be larger amount of dosages?
Yes.
Okay.
We will begin receiving second doses for individuals who need to come back along with our next allocation. And once we get to those other groups, I fully anticipate that our allocations will be larger. And also, I believe that the manufacturing will also kind of increase to accommodate the needs as well. The manufacturers were producing the vaccine at the same time they were doing clinical trials, but now that it's been approved, I suspect they'll be able to increase their production. So, and then there also may be new vaccines that will come to market in the next few months too. So we fully expect our allocations to be larger. I certainly hope so, or it will take us a longer time to get through it. But we've always planned for pandemic vaccination efforts to have all of our vaccine at one time. And so this is a little bit different for us to have to roll it out in stages.
So, and at the rate that we are going now and anticipate an increase, are you looking like at early fall that we should have most of our people vaccinated, those that choose to be, or are we looking out further beyond that?
I think that's going to be a little bit hard to predict. There's so many factors, but we've been hearing by summer, we should have a good supply, and that, yes, by fall, it'll probably be available to everybody who wants to receive it. We may also have a childhood vaccine by then, I'm not sure. So that would add new levels of vaccination effort to what we're currently doing if that becomes available this year.
And the only reason I ask is because I'm involved with an organization that's planning a large event this summer in June. And, it just doesn't seem like we're going to have time where we would have enough people that would have the herd, whatever that is, immunities at that point in time. And so, trying to weigh that all out and just get a sense of the direction we need to go with that. And then I only have one other question, and that is, are there any medical conditions that you are aware of where somebody shouldn't have the vaccine?
The only ones that I'm aware of are allergies to a component of the vaccine or a severe anaphylactic reaction to other vaccines. Those would be contraindications. In the latter one, it might be able to be managed. The former one, no. There are some people who will not be able to get it and will have to depend on the herd immunity. There is one particular, I don't know if Michael's still on, if he can back me up on this, there is one particular substance called PEG, P-E-G, I think it's polyethylene glycol. That's a component of one of the vaccines that has been sort of implicated in some of the anaphylaxis. And so if anyone has a known allergy to that substance, they would not want to get that vaccine.
Thank you.
Okay, any other questions of Debbie? Thank you, both Michael and Debbie, for your presentation. It's exciting to get more positive news on a public health standpoint than negative news we've had in previous weeks. The next thing on our calendar is the Emergency Management Director.
Madam Chair,
She
Yes.
had one
I
more.
think she has.
Oh,
one
I'm
more
sorry,
slide.
Debbie, you did. You had one more request. I apologize.
Yes, Madam Chair and members of the commission, thank you. I do have one additional request for the commission, and that is I wanted to provide you with the status of hiring the staff for the county schools and Grand Forks County Correctional Center. Well, this was a fantastic idea. When we embarked upon it, we didn't have any idea how challenging it would really be. And we have conducted some interviews. We've had a couple of candidates that have turned us down because we haven't been able to meet their salary requirements. Keeping equity in mind for the entire department. We do have one candidate who's very promising. We've offered her a position and she's considering it for the county schools, but we still have yet to hire anyone for the jail nurse position in the second position for the schools. We're hopeful. We have been backfilling that work with our existing staff. So we have a team that supports the schools, answers questions, provides information, helps them with contact tracing. And then we have a team leader from the health department that has been helping at the jail on days when they're really busy with testing and other activities, but we haven't been able to hire the full-time positions. We are going to start over recruitment once again, but my request to the commission would be to change the terms of funding in our agreement, the one that's between the city and the county, from the previous grant period of October 1, 2020 to September 30th of 2021, and move it to just this calendar year of January through December. You may want to consider that in the big picture, because the other schools wouldn't necessarily get more funding for next fall, but it would put at least a couple of the schools in the position of having a school nurse and additional assistance to our department for the entire year. So I just wanted to point that out, that we didn't want our funding to be cut short simply because of our recruitment challenges. So that is our request, if you would like to consider that.
And I don't believe in changing dates. Do we have to do that as a resolution? Or is that just an administrative change?
Madam Chair, I think it would be good that we had a motion, because we do have a motion now that
Okay.
has October 1st through September 30th.
Okay, so we are looking for a motion then to change the time that we would be utilizing nurses both in the jail and the schools from January 1 through December 31st of 2021. Does anybody want to make that motion?
Madam Chair, I'll make the motion.
Okay, and is there a second?
Second.
All right. I don't believe there needs to be any discussion. So assuming a roll call vote, all those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Then that motion is carried.
Thank you. And
Anything else, Ms. Swanson?
I just want to thank the commissioners and other county officials that have really been helpful to us during this pandemic time. It's really been appreciated, and it's really been noticed by our staff. So thank you very much for your support.
You are very welcome, and thank you and your staff very much for all the hard work and all the essential workers that we've had that have stepped up to the forefront during this past few months. It's very much appreciated, and they put themselves on the line, even though they've had to leave their families at home and they've had to go to the workplace. So that is very much appreciated. The next item on the agenda is emergency management. Ms. Getz, are you available?
Yes, I am, Madam Chair. Good afternoon, members of the commission.
Good afternoon.
Happy New Year, everybody.
Happy New Year.
Virus went away January 1st, so time for smiles. So I come tonight with a couple of things. The first one is the hazard mitigation plan. FEMA requires all counties in the country to have a multi-hazard mitigation plan in place in order to qualify for mitigation funds during times of disaster. Each county must have the plan approved by all voting jurisdictions within the county, and then FEMA has to approve the final plan in order to meet the requirements. The Grand Forks County Plan was last revised and adopted by the board in 2015. We began the updating process for this plan almost a year ago. We had the help of a mitigation grant that allowed us to hire a contractor to help us. We held community meetings to solicit input from the whole community throughout the county. And from what I understand from our contractor, we have actually set a record for the attendance at our engagement meetings. They have never had a county have such a good turnout for those engagement meetings. So I was pretty excited to hear that. Tonight, what I'm asking is that the board adopt the revised plan, as well as having the chair sign the city and township resolutions that Ms. Nelson has in a folder on her desk. Once that's done, we'll send those to state DES, and they will get them to FEMA under an expedited agreement so we can get our plan approved really quickly. That's all I have.
Okay, so we have a hazard mitigation plan that has been revised, and we need a motion to adopt that plan and ask for the chair's signature.
Madam Chair, I'll make a motion.
Okay, is there any one to second that motion?
I'll second it, Tom.
Thank you. And any discussion on the hazard mitigation plan? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Then that motion is passed. Anything else for the good of the order, Ms. Getz?
No, ma'am, that was what I had for tonight. Thank you very much.
Okay,
Madam
thank
Chair?
you very much and Happy New Year to you. The next thing on the agenda is Mr. Ford.
Thanks, Madam Chair, members of the commission. I have no report to give tonight.
Okay, thank you very
Madam
much.
Chair, I have a question.
Yes,
The hazard mitigation plan, is it a 100-page document or is it 10, or is it something that we'd have a chance to read at some point, or is it not worth it?
Actually,
I think it'd be well worth reading.
it's a very comprehensive plan, Commissioner Engen. I do believe it's pushing close to 300 pages, if not 325. So we have it in a digital format and we'll be posting it on the website once it's got its final approval. But it is a very interesting read. It's got a lot of depth to it. And I can certainly send copies to the commissioners for those nights that you can't sleep.
Well, or else we could have the Director of Administration read it and summarize it.
I would defer to the Director of Emergency Management for that, Commissioner.
No, that'd be all
I'll
right.
see
to
if we
send
can
us
do an
visualized
executive
copy
summary.
of it. All right.
I have read quite a bit of it because I went to those meetings, but I have not read it entirely, in its entirety. So I believe an executive summary would be very good. All right, moving on then, State's Attorney, Ms. Wamstead.
Madam Chair, members of the commission, I have nothing for the commission's consideration today. Thank you.
Thank you very much and a Happy New Year to you. Committee reports. Ms. Knopf.
I have nothing to report.
Okay. Commissioner Falk.
You're muted, Tom.
Is he just waving?
You're muted.
Tom, you have to unmute yourself. Okay, we'll go on to Commissioner Engen while we're waiting for Commissioner Falk. Commissioner Engen, do you have anything to report?
I have nothing to report. I'm just waiting to hear from Mr. Falk, Commissioner Falk.
Okay,
I'm back. I lost my screen for a minute. I've got nothing to report. Thank you.
okay, thank you.
I
very
appreciate
much.
all your concerns.
Okay, Commissioner Ross.
Just that the MPO met a few weeks ago, and a very extensive 1.5 to 2 hour meeting on projects to come up. And once the minutes is put out, I would be more than happy to share with the rest of the commission. So a lot of road projects coming up, and some were deferred to later years. So interesting.
Okay, wonderful. Thank you very much. And as far as myself, I have nothing to report at this time either. So we will move on to unfinished and new business, the 2020 budget amendments.
Madam Chair, members of the commission, I have on page 51 some additional budget amendments. You passed some at the last meeting. There was some additional spending that occurred for the end of the year, and every one of these funds had offsetting revenue. So I need a motion to approve these 2020 budget amendments.
Okay, somebody want to make a
I make a
motion?
motion to approve those amendments.
All right, is there a second?
I'll second, Dave.
All right, any discussion on these? If there is no discussion on these, assuming a roll call vote, all those in favor of the motion signify by saying aye.
I,
Aye.
Oppose, same. All right, there are nobody opposing, the motion has passed.
Madam Chair, members of the commission, there's one other item I had for unfinished new business.
Okay,
And that was at the last meeting, you guys approved a public hearing for the Red River Biorefinery to be held today. Well, they did not get all their public notifications done in time, and they will not make it for the next meeting either. So it won't happen until February 2nd. So we do have a motion that we were to have a public hearing today, but that public hearing is not going to happen until February 2nd. So I don't know if we need another motion or.
maybe we should just have a motion in the books that the public hearing that was scheduled for today is postponed to February 2nd for the biorefinery. So if somebody wants to make that motion,
This is Tom. I'll move to continue the public hearing on the biorefinery matter from today until February 2nd, I believe is the date.
that is correct. All right, thank you. Is there a second
Second.
to that motion? There is a second. I believe there's no discussion necessary. So assuming a roll call vote, all those in favor of the motion signify by saying aye.
I,
Aye.
Opposed, same sign. The motion is carried. I don't believe we received any correspondence, so that will put us to the adjournment of the meeting. Would someone like to make that
I
motion?
would make a motion that we adjourn.
Thank you, Commissioner Ross. Is there a second?
Second, Tom.
All right, assuming a roll call vote, all those in favor of the motion signify by saying aye.
I.
Aye.
Aye.
Opposed,